welcome to this first virtual city council meeting on March, what is this? April 8th, 2020. So thank you all for joining us. Thank you all for your flexibility and adaptability in figuring out how to manage these council meetings. And thank you very much to staff and Lena for getting us orchestrated and Beth for managing the timer. And we will learn as we go, but thank you all for being here. And it is really nice to see your faces all together again. I'm really happy to be back in a place where we not only keep going on our COVID work, but pick up where we need to on ongoing city business. And so with that, I will turn it over to the manager.
Great. Thank you, Mayor. It's welcome back from your break. I'm sure it hasn't felt like much of a break, but it's good to see your faces, even though it is virtual. I want to also just acknowledge that all of you have been in such great communication with me over the last few weeks. And so I've never felt like you've been on break, and I'm sure you haven't either. So I just want to thank you for that. First and foremost, I hope each of you and your families are healthy and safe at home. I know this is a particularly challenging time for all of us. In particular, when the sun comes out, it always, I think when we got together around the emergency order, I mentioned how odd this is because it just seems so normal outside. And when it's sunny outside and things are blooming, it's hard to remember that we're in the midst of a pandemic. Last night, I turned on the news and saw the statistic that 2 people per minute or 1 person every 2 minutes was dying in New York. And I was like, wow, after just seeing people jogging by my house, it's just really hard to comprehend the situation we're in. Clearly not as severe here in Lane County, and hopefully we can continue to keep it that way. So you probably have noticed a few changes to your agenda. The tentative agenda has a lot of COVID-19 holder spots, and then it has a lot of TBDs. And the intent of that is really, we know you're going to have a lot of questions about what's happening with our response and then what's happening with recovery, how we're adapting as an organization. So we wanted to make sure we're holding enough spots to kind of give you updates, not just on the public health issue, but just all of the impacts of that. And then the TBD is really waiting for us to have a discussion with you on Monday night around what your priorities really want to be between now and July, and kind of the end of July. So we'll populate the agenda much more thickly after Monday. For today, we actually have 3 items that are going to need to be covered. So the first one is, I'll turn it over to Chief Heppel in a minute to give you an update on where we're at with our emergency operations. I wanted to talk to you about extending the emergency declaration. It expires on the 14th. And we were kind of hoping to get into a rhythm where we stay a little bit ahead of that. So if you wanted to weigh in on that and support that, today would be a good time to do that. That would extend us from the 14th, I believe, to the 28th, which is seems like a good amount of time. We have to do it every 2 weeks. So if you want to continue talking about that every 2 weeks, you can always vote your support, but it's not necessary, but it's nice for you to be able to do that. And then you'll need to take action on the Northwest Natural Gas franchise agreement. So I want to make sure we leave enough time for that. So with that, I think I'll turn it over to Chief Heppel. But in doing that, I want to just say he's been amazing. And everybody in the Emergency Operations Center, from our, typical people you would see in there that have a lot of experience in emergency operations, to some of our library employees and cultural services employees. It's been really an across the city effort. And I want to thank him for his leadership and leading us through this. He's been amazing.
Hey, thanks, Sarah. First of all, sorry about my camera. We had it up and running, even test drove it yesterday, and something happened in the gremlin world. But hopefully, I'm going to start sharing a screen with everyone. And hopefully, just folks should be seeing my COVID-19 update screen. Is that correct?
Yes.
Great.
Yes.
All right, great. So with that, Mayor, councilors, happy to be, or great to be in front of you again. Just a quick update as to what's going on. Slide. Oop. There we go. Had dueling controls there. So needless to say, this is a dynamic and fluid situation, and we're in a space that we've never been in before. Every day has come with a new set of challenges. Every solution has come with a new set of challenges. Um, and the team has really come together well over the last few weeks. We officially opened the EOC back on March 13th, with a couple of our primary objectives. One being making sure we're taking care of our community, we're taking care of our team and our staff, and ultimately supporting the public health initiative to flatten that curve. So on the slide, you'll see, what our goal has been is the introduction of protective measures, many of which have come down through the governor, through directive in terms of our stay home, stay safe type policies, utilization of personal protective equipment, et cetera, all in an effort to keep our infection rate below what our healthcare system capacity is. So when we started this, Seattle was quite an epicenter of this. And if you've noticed, as we transitioned, the city of New York, Detroit, and New Orleans have now become some focal point areas, and they're more in those peak type curves where it's not that they didn't have protective measures, but the resource utilization and their infection rate and the folks affected are such that it exceeds the capacity of their healthcare system. And that's why even the state of Oregon stepped up and we sent 140 ventilators to New York just last week. That's also driving a lot of our access to personal protective equipment. The federal government is managing a big portion of that, and Oregon is getting its allotments, whether it's from the national stockpile or from manufacturers, that then goes to the Oregon Health Authority, and then we've got a distribution plan in which that we share that personal protective equipment down across all 36 counties within the state of Oregon, and then the county is responsible for distribution from there. Overall, Oregon has done a good job of that. There's a couple of different sites out there. One I look at is the University of Washington has got a site where they look across the United States. They added some international stuff now as well, where we were looking at our peak. So our peak of resources and infection rate was going to be somewhere around the first part of May. And earlier this week, they actually updated that and it slid to the left. And we're looking more around May 21st. So while that's a solid indication that what we're doing here in the state of Oregon is the right thing and folks are staying home and staying safe, only taking those necessary trips, exercising physical distancing, et cetera, I can't stress enough that that could easily be wiped away with folks not continuing to following that in a sense of, basically, I don't want folks to get a sense of comfort and that we're beyond this. And we are not beyond this. We're still very much in this. And again, we're not even scheduled or predicted to hit our peak of resource utilization until about the third week of May. So just real quick, nationally, we've seen almost 375,000 cases with approximately 12,000 total deaths in Oregon. We just went over 23,000 have been tested, resulting in 1,181 positive cases and 33 reported deaths. More specifically, here in Lane County, we've completed just over 1,000 tests with 32 positive cases and 1 death. And the majority of those patients who have been identified with COVID-19 are what we call medically stable and are within their residence at home. So that's a good place to be in where we are in this whole pandemic, and hopefully we're going to stay there. Let's talk a little bit about what's going on here. So again, the Emergency Operations Center started on the 13th, so we've been officially open 3 weeks as of Monday. And this is just a quick look into the EOC during the early activation. And it's truly a mix of highly dedicated staff from all across our organization. So there's not a department that is not represented or participating in the EOC and providing resources to the rest of it. The EOC allows us to streamline our emergency management functions and tap more efficiently into our regional partners. So we work with Lane County, Springfield, as well as the state, so Oregon Health Authority, as well as the Office of Emergency Management. pretty much on a daily basis. The other nice part about this is it helps with our collaboration as well as our partnership. And that absolutely has been one of our successes to this date. If we take just a simplified schematic of our organizational structure, the folks in the green and the purple are what we call the command staff, or the report directly to the incident commander and the EOC manager. And then the folks below is what we call our FLOP, or our finance, logistics, operations, and planning. Why this system is important is because, remember, we cross geopolitical boundaries every day. And so when I talk to the incident commander at Lane County, which is Karen Gaffney, she has the same organizational structure below her. So the people who are working the same issues in Eugene, who are working the same issues in Lane County, know how to coordinate and who they're working with. So it really provides that common language all the way from here at the city all the way up to the federal level. And that's why we have this process in place, is to reduce that. So let's talk about each one of those sections and what they've accomplished so far. So look at the EOC side. So they're tracking our costs, develop purchasing agreements, they approve EOC purchasing processes, et cetera. And they continue to track the applicable costs associated specifically to this event, and to ensure that all of our eligible costs are captured for potential reimbursement. As you may have known, the Stafford Act was enacted a couple of weeks ago by the president, which allows for a level of reimbursement for our activities and services that we're providing through the EOC. We've also completed our request for public assistance, which will allow the city to apply for that reimbursement and also make many of our expenses eligible for FEMA reimbursement. Also with working that through the Oregon State Emergency Management or OEM. So an example of purchasing agreements that the team did early on to get things up and running was our employee child care agreement. So when we started to go to that stay home, stay safe, those essential employees that still needed to come in, but daycare centers were shut down, we were able to coordinate with our local partners such as 4J, the YMCA here at the City of Eugene, and many others to provide that so we could keep our system going. If we look at logistics, pretty heavy lift here, but they're responsible for procuring many of our needs and a lot of those material things such as personal protective equipment, including they also work on bringing in people, so our people resources from outside, as well as supplies and other materials. Some of our accomplishments there is, they were really efficient and effective at bringing in the folks that were needed to fill the EOC incident command structure, and then activated the associated systems and processes in that structure. I think why that's important is because literally we asked folks to come and help and support us and be a part of something that many may not have ever been a part of. And if you could see where we were on the first day and how logistics and planning and all the other units came together, and see how efficient our process is today, I am certainly very proud of that, and I think you would be as well. One of our heaviest lifts here is the personal protective equipment, and sourcing those items. Our first priority is to try and use our current vendors, local components, et cetera. Then we start looking outside, and then we also have a process where we can pull things in from the state. But the state piece is absolutely our last choice. So kudos to logistics who have kept our nose just above the waterline and getting in the limited supplies that we have and then appropriately utilizing them. Logistics also played a critical role in setting up our designated temporary shelter sites just this week, as well as the materials handed out at the distribution centers, as well as our outreach teams. If we look at the operations section, so this is our O and our FLOP. So these are the folks that are coordinating the efforts that are going on today. And the significance of accomplishments for them have been really how they've implemented a four-pronged approach to dealing with our challenges. That first one is the hygiene component and how they've deployed out portable restrooms across the cities, as well as 50 hand washing stations, and then monitoring, servicing, and keeping track of them. And they've also uploaded those into a geographical information system, or GIS layer, which is actually accessible through our City of Eugene website. The next piece was our outreach teams. So one of the guiding principles of this pandemic is to keep people in place. And we're trying to do that with our unhoused community or population as well. As if they're settled into a place, is there a way that we can help support them to keep them where they are, so they're not as migratory or mobile as they are. And so our outreach teams, we have 3 teams, which are made up of 2 to 3 folks. I think we have a total of 14 people assigned to there right now, and they make routine and regular check-ins at known areas where folks have needs, such as supplies. And then they also provide information on COVID and how folks can be safe. The next one is our shelter component. So the staff has established 2 designated temporary shelter sites in coordination with Whitebird. And these are located at Hilliard and Amazon community centers. We just opened those earlier this week. And they're up and running now, and we have plans and abilities to open up other sites as we go forward. And the last one there is supplies. So this week we also opened up what we're calling our distribution center. Again, that's in coordination with Whitebird, and it allows folks who have needs predominantly in the homeless and unhoused community to come and get some of those essential supplies. But we're able to do it in a coordinated manner, so we're not having folks congregate. Remember, that's one of our guidances, is that we don't want folks congregating in areas, and that's why we're seeing or utilizing these smaller groups, because they're easier to manage, maintain our physical distancing, et cetera. So since we've been up and running a couple days, we're actually seeing more than 50 people a day who are actually coming through that distribution center. Another role of our distribution center is they provide some basic medical needs, and they're able to refer folks to our designated temporary shelter sites as well. From planning, so these are the folks that are looking out into the future, and it's our most procedural group by nature, with a focus on how the operations center itself and complying with daily action, and they compile the daily action plan, including objectives and strategies. One of the key functions within this group is also documentation, which is in our benefit when it comes to potential federal reimbursement. If you didn't know, we actually create a EOC plan on a daily basis. It's usually completed at 1800 or 6 o'clock at night. And then that plan is activated and utilized for our next operational period, which begins every day at 8 o'clock. And we kick it off with a morning briefing at 08:30. That does change a little bit on the weekends. One of the big pieces they're looking at is long-term community recovery. So while we've got a lot of efforts focused on immediate response to the virus's impact, the ripple effects of these impacts will happen weeks, months, and even years after this initial response. So long-term community recovery focuses, that group that's working on that is focused further out than the initial response time. And the goal is, and it's important to have a unified local and regional recovery effort. And so we're also working on this in conjunction with the county as well as the city of Springfield. So we're not doing this certainly in isolation. The long-term community recovery efforts also focus on employment recovery as well as opportunities for implementing stimulus dollars in a strategic way locally, and allowing large public and private projects to carry on while utilizing our existing programs and tools for the development and public assistance. So as we move forward, we'll keep an eye on that from a legislative lens as to opportunities that are going to be provided to our folks in our community and our businesses. Probably the heaviest lift is our public information, and communication is a critical piece in any emergency situation. And keeping our message very consistent, as well as being in alignment with the lead agencies who have consistently been Lane County Public Health, Oregon Health Authority, and Health and Human Services at the higher levels. So our liaison team's been working with agencies across the state to get situational updates, as well as staying ahead of hot topics, including the governor's stay home, stay safe order, and the regarding the status of local businesses and safe use of our outdoor spaces. Our public information group is also amplifying county, state, and federal messages by providing news releases, videos, joint press conferences, social media, and email blasts on an absolutely almost seems like hourly basis. In fact, just this week, we sent out an email to more than 64,000 accounts this week on the status of what we're doing here in the city. One thing we know about emergencies is that we tend to unite people for a common purpose, and certainly this pandemic is no different. Over the last several weeks, it's been amazing the ideas and the creativities and the passion that our community members have shown. We've had folks show up here or send us products that have been done, like with 3D printing, in terms of respiratory mask ideas or face shielding ideas have been very interesting, as well as some alternative cleaning methods in terms of utilizing a paint sprayer hooked up to an air bottle that could be utilized to help clean out the back of ambulances or public safety vehicles or buses, et cetera. Many local vendors have come up with or provided opportunities for making of like the cloth masks, as well as meals have all been great. And I even look into our city ourselves. When we look at over in PDD, they've explored safe ways to do remote inspections. So folks who are on construction sites can dial in using video conferencing and facilitate inspections. So those are some pretty neat things that have coming out of this. Ultimately, here or button it up is our entire conversation. I hope you've heard me say is framed around our safety, and it's one of safety not only for us but just a community as a whole as we go forward. In our emergency operations center, more and more of our folks are working virtually. Better than 80% of our folks are actually at home working virtually. So there's only a handful of us that are actually here, and we're able to maintain our physical spacing. And here being a second in chambers. We continue to provide the latest safety guidance to our safety and staff. And certainly while our area has not reached an infection of what we've seen in more densely populated areas, we have to stay the course. I could say one of my concerns is our nice weather is going to probably tempt folks to go outside and become dangerously close together. Data that's coming out can lull people into a false sense of security. But we need to continue to heed the message from those of our lead agencies, and that is continue to stay home, stay safe, and maintain your social distancing. The governor's executive order is just barely 2 weeks old, but the message continues to be true. Stay home, stay safe, and we're going to continue to go through this for a number of weeks still. With that, I'll open up to any questions.
Okay, let me see if I can pull my list up and see if folks have raised their hands. Chief, I just want to begin by thanking you for your really extraordinary work. That was a wonderful presentation, and certainly my experience from comments from the public or people are really feeling that the city is in good hands, that the system is functioning, basic things are functioning, and when people have questions, the staff is very ready to respond thoughtfully and helpfully. So I really do think the communication has been very strong and the operations have been strong, and really it makes us all proud. So thank you for the work that you have done. It's extraordinary. And let's see, do I have any counselors with hands up for comments? I do. Let's see. It looks like Counselor Clark. Surprise, surprise. Take it away. You're on mute, Mike.
Right. There we go. I wasn't sure that was my choice with the mute there. So I want to echo echo the mayor's remarks and say that I think that our incident command folks have done a fantastic job. And I think the evidence of that is real clear to everybody in the way that our community has stayed safer than so many others. I did have a couple of specific questions that are really more pass-through questions from constituents. And I guess I'll bundle them all up just for now with one. I didn't hear you speak to the idea of public safety challenges or differences too much with this, with regard to specifically there are business locations that have had issues around vandalism and issues around with the building space being empty, being able to keep folks out that shouldn't be there. Is there any kind of, can you talk about how the police are dealing with issues like that?
Yeah, I
Yeah,
can't speak. Somebody there?
I was just going to say, Chief, that Chris Skinner is on the line and can be, I believe he's on our list of attendees. Maybe not.
I just unmuted him and he is,
Okay.
so he should be able to speak now.
He's still muted.
It doesn't always come off mute
Yep, yeah,
quickly.
there you go. All right, so Chief Skinner's online.
So can you hear me okay?
Yeah.
Okay, perfect. Councilor Clark, thanks for the question. We have, first off, let me say that we've been doing a fairly deep analysis around our calls for service to see if we've actually been freed up to be able to do some more proactive policing, which would mean being in neighborhoods and in business districts that we know that are somewhat abandoned, so that we can spend a little bit more time in a proactive and preventative nature in our policing strategies. And what we found is we've been just as busy as we've always been, which is not the same for most jurisdictions. I think it speaks to just the volume of calls that we deal with pre-pandemic, that even with a slight dip in some calls for service, it still outpaces our capacity to be able to respond to all calls for service. So some of the things that we're trying to do, though, is we're trying to still be out visible. Our downtown team, while largely there's not much pedestrian traffic downtown, the downtown team has tried to pay attention to these businesses that have been vacant in a way of trying to do that. One of the big areas that we've had some problems in is the vacancy of downtown and our parking garages, where a lot of our downtown ambassadors were able to make a lot of rounds in, have been largely vacated. And so we've seen an uptick in vandalism and criminal mischief in like our parking garages. And so I know that we were having a discussion as early as this week with the downtown policy team about taking a look at what we need to do differently because of the lack of activity, and strong activity in areas has a tendency to be a deterrent for criminal behavior. And with the lack of that activity and just people being there enjoying that space, we have seen an uptick in that. And so I don't have a great answer for you in the sense of what we're going to be able to do, other than to say that it's on our radar screen and we're trying to deploy some police officers a little bit differently, and through some good analytics, identifying where we need to be and when we need to be there in an attempt to deter that crime.
Thank you, Chief. I had another kind of broad general category of questions for the manager. This one's, again, you guys have done a fabulous job of addressing and attacking the problem of changing this, our city and how it operates and how people interact with one another so quickly. Done a really, really fine job. But we have some tall lifts, some heavy lifts ahead of us with regard to getting things back to normal someday, and how we can use more of the resources that are at our disposal. I'm wondering if there's any way, or if there's been any thought given to the idea of how to engage the public for their safe role in addressing some of the problems we face. For example, just people's ability to volunteer. If you look at social media, you see all the stuff that people want to do to help make face masks, or or those sorts of things. Are we actively engaging the public in terms of their role and what they can do to help safely?
Chief, do you want to talk about that from the EOC perspective and how you've been responding?
Yep, absolutely. So, Councilor Clark, as part of our emergency operations plan, we refer to those as ad hoc volunteers. So, volunteers that aren't necessarily vetted through a system, similarly to like our CERT teams. So, which we have here in the city, which fall under our emergency management. And so we rely on a program that's called Community Members Active and Volunteers in Disasters called COVID. And that's run through the county. And they have a website, and it's supported strongly by United Way. And in fact, it's actually operated by United Way. So they bring together many of the traditional nonprofit organizations that provide services on a daily basis. It connects all of them. And then it allows for ad hoc volunteers to support those agencies. And then if there is a need that that group can handle or manage, it goes through the county emergency manager, and then the county emergency manager tasks that particular group to complete that task or that mission, as we would say. And that's how we utilize that flow and ad hoc volunteers if they're not previously vetted, again, as organizations such as CERT.
Is there anything we can do to more publicly? I mean, I know that the PIO has 100 things on their plate, but is there anything we can do to further and maybe more step up our ability to share with folks what they can do to be helpful in this time, and the links to that site and so forth?
Yeah,
so
we can definitely do that.
On our city sites, we've definitely got links to all that. Those were early questions that came on. I think one of the other questions that we run into, and I see this in many of the disasters that I deal with, is, well, folks have an urge to volunteer and support, and we want to encourage those types of things. Right. It's also that may not particularly be a need at this time during the pandemic. And so that's another piece we balance, and why we utilize that COVID process is, we're doing, okay, we need more of X product, but we need less of that. I recognize that I'll give you an example, is casseroles. Folks want to make food. How can we feed the EOC and help them out, and et cetera? And while we're certainly appreciative of that, that's not a product that we can bring into the EOC just from a health perspective. But there's a lot of people who want to do those things, and that's something I can do. But there's not necessarily a vehicle for it. So my goal is to get them plugged into those organizations and say, this is what we need, and can you help us with this?
Awesome. It may be, and I know this is something that's probably obvious, but to the degree that people could cook, they could also help with keeping some of our takeout restaurants from experiencing too much heartache and financial jeopardy by being a provider of food from an established source. Perhaps that would be able to, you understand what I'm saying?
Yeah.
Yes, Councilor.
Yeah, and it's interesting. I've seen a couple of things. For one, our EOC is using those established restaurants every day to feed our staff that are on site. And you may have noticed a post early on by IAFF that they had started pooling their resources to purchase food from restaurants that we're still doing takeout to, and in order to support the business community, which I thought was really neat.
Great idea. Thank you.
Okay, Councilor Zelenka.
See, the unmuting thing isn't that easy.
Yeah. You think it would be, just touch it. No,
right.
But no, not necessarily. I don't really have any questions. I just think you all, and Sarah, your leadership has been tremendous in terms of organizing all of this and getting ahead of the curve, setting this up early and getting it and having us practice it beforehand has really paid off in spades. So I think we are in tremendous shape. I feel really well taken care of, and I feel like you guys have really got it under control. So, and as well, the community has really stepped up as well. They're staying home. They're practicing proper social distancing. As Mike said, I think things that we can do, information that we can get to people that they can do more, and how they can help, and getting some takeout from folks in the community from the different restaurants is a great way to do that. I know I've done that several times. And wearing masks is now an important part of what we do. But this is, unfortunately, this new normal, which isn't normal, is going to be with us for a while. So I guess I did have one question. So Chief Hempel, the report I heard about, maybe I misheard this because it was flying by on the radio, was that because we were doing so well in Oregon, the peak day moved from early May to April 21st. I think that was right. And you may have said May 21st.
Yep, you're absolutely correct. The staff in the room corrected me on that as well. So yeah, it did go to the left and I gave the wrong date. So you're correct. It's April 21st, not May 21st. Thank you.
Yeah, I thought it was your left, not my left. So that would make sense. So that's actually great. I mean, that is proof positive that what we're doing is working and that we need to keep doing it and making sure that all that moves forward. So what does that actually mean in terms of looking at an end date for all of this, Chief?
So, as I'll always preface, not an epidemiologist, but what that really is I think it's a solid indicator of how it's going to stress our system and our resources, and from a planning perspective, making sure we keep ourselves in a good place if it does peak up. In terms of what does that look like on the backside of the curve, I don't have a good answer for that, as much as it is I'm going to be looking for trigger points from Lane County Public Health and the governor's office of they stop recommending certain practices, the physical distancing is removed, businesses reopen, et cetera. So the end game here is the longer we can stay in this, it's not that it necessarily shortens the time, but it flattens the curve, which reduces our resources. Because if we start exceeding our resource capability, that's going to put us into a bad place. And then this thing comes back out of containment again.
Right. So not stressing our medical system, which is why the Governor Brown was able to send 140 ventilators to New York, because we don't believe we're necessarily going to be stressing our system. Because we did all this early, the governor did that really early, and we've been doing it so well that it really is making a big impact.
Correct.
Yeah. Okay. Thanks.
Okay, Emily Semple, you're up.
Okay, unmute. Thank you very much for the presentation. I hope a lot of people get to watch it because there's always questions. I'm really pleased with the number of website links that are out there to information for a whole bunch of different groups. I know everybody, not just me, although I'm getting emails about the camping at Monroe Park and how complicated it is to give people a place to sleep and also give people a safe place to be out in the green. My biggest concern right now is people are very close together, and the neighbors are pretty upset. So I've been emailing a lot, and I have to congratulate staff on getting back to me very quickly. But I think that the problem is not resolved. I'm concerned what happens if more tents come, and I think right now it's the only park, but I imagine that might change. So one of the frustrations is that the new sites are great at the community centers, but they only hold 20 people altogether. And we need to separate more people than that. I understand our problem is staffing them because we don't have trained people. So I'm wondering how long we think till we can get more sites, parking lots, and is there anything we can do to speed it up? Parking garages, I've thought for quite a while would be a great place. I think there's some fire marshal problem with, well, not a problem with the fire marshal, but a problem with the garage. So if we had people there, it might reduce the problem of vandalism. And so I'm looking for some feedback on that, and then I have a couple other things.
Chris, I can answer this unless you have, if you want to jump in at some point, if there's new information since our earlier phone call. So we've, as you can imagine, this has been a really challenging situation to figure out almost on an hourly basis as we come up with plans and strategies, and then people's behaviors don't act upon our plans and strategies, and we have to adapt. So it's a really adaptive leadership in motion. I've seen a lot of the same emails that you have, a lot of them saying that, suggesting I'm abdicating my responsibilities as city manager by letting these things happen. And I think, one of the challenges is like this, nobody ever predicted when they wrote those job descriptions that we'd manage a pandemic. So the situation at Monroe Park was challenging and continues to be. And let me tell you kind of where we're going with that. So when we first started, it became really clear from our public health experts that the stay home, save lives really needed to extend to anybody that was in a tent home or wherever they were, that the whole way we were going to flatten this curve was to stop people from moving around the community unnecessarily. So if people were in place and there wasn't a public safety issue, then we would keep them in place. We had a couple of issues early on that were public safety issues. We moved those individuals, and we had a lot of people not happy about that, including public health. So what happened with Monroe Park is we had a couple of people get in there after the stay home, stay in place. And so that makes it more challenging is you weren't there and now you are there. What do we do? Do we move people? And at first it felt like, well, we can leave them there and that's the direction we should be going. But like I said, like people's behaviors change. We didn't anticipate that one more tent would come. And our conversation earlier this morning is around really our neighborhood parks are not, don't have the capacity to accommodate camping and people using the parks. There's just simply not enough space for that to happen. And it's, they've never been built for that. And while we're trying to maintain the health curve, we also can't have people getting exposed unnecessarily there either. It's hard to walk around Monroe Park and not be within 6 feet of somebody if they're camping right there. So we're working through that, trying to figure out now that we have some spaces open where we can move people. My stance, and I think our stance now, is that we're not going to let people camp in neighborhood parks because they're not there now. And so they shouldn't be moving there. They should be staying in place. So we do have plans to open a couple of more sites, and we'll be moving forward with that probably as early as next week. My concern with the parking garage is that to me has to be a really last resort when we have like a really prolonged significant event. And part of that has to do with the amount of vandalism we're already seeing in our parking garages. They're not safe places for people to be at the moment, and we don't have the ability to secure it. So I struggle with that one a little bit, but I think that if we end up in a prolonged time, we may get there.
Thank you very much. People have been asking for us to connect with them more. I'm grateful to the mayor for making the press conferences, and I'm not really sure how to do that. I am locked out of Facebook, it looks like forever. And so I want to tell my constituents that I'm working on everything and I really care. And if someone can think of a way to help me communicate, I'd really appreciate it. I'm really happy with staff. I thought about some attributes I would like to have if I were them. And I came up with calm, prepared, and competent. And I think that's what we have. We're really lucky. And I do want us to remember that it isn't a time for opportunities, a time for new solutions. We can be innovative while we support each other. And please keep giving blood. That hasn't gone away. It's safe. We need you. And please stay apart. I am seeing people too close, especially in the park. Keep up the good work and thank you.
Thanks.
Okay, I don't seem to have anyone else in the queue. If I'm missing you, you can actually wave your real hand or hit your virtual hand. There we go. Claire, go for it.
Thank you, Mayor. I was trying to find the raise your hand button. So I just want to echo what others have said about being really appreciative of Sarah, your leadership and our executive team's leadership and all the work that staff has been doing. I echo the feeling that we're in good hands, that we're ready to get ahead of this thing. And as soon as the governor's orders were in place, we were implementing. And so I really, really appreciate all the hard work of everyone. And then just wanted to also say I support the position that you just outlined in terms of not having our neighborhood parks be a place that folks shelter in place, that they are too small to accommodate that usage, and they really need to be reserved for folks in those neighborhoods to use for getting outside and getting some of the green space activity that they need to. So I have confidence that you and your team will be looking for more appropriate places for folks to do that shelter in place. And so I just wanted to say that out loud.
Okay, thanks.
I have Alan looking. Anyone need a first round before Alan jumps in? Okay, go for it, Alan.
Something that Emily spurred. I wasn't going to talk about it now, but I've been thinking about a lot of our neighborhood associations in my ward in particular have really healthy email distribution lists. And what I was thinking was it would be helpful on that list to be able to have an email kind of outlining the things that the city's doing and how and give some resources to where they can go for more information. So if some of our public information officer folks and communications folks can put together something that would easily be turned into an email with some links, I think that would be a great way of communicating with folks. I know that a couple of people, Representative Willie did that in a couple of my neighborhoods. And so it's an easy way to get information out to not everybody by any stretch of the imagination, but a good chunk of people, and they tell people and they forward it. So it does have that email chain effect go on. So if we could get something that would work in that regard, that would be very, very helpful.
We had received a letter from the Neighborhood Leaders Council making some suggestions like that too. And we committed to sending some information to them, and also agreeing that I would attend virtually the next Neighborhood Leaders Council meeting and try to have staff available every month when they do that to keep them up to date as well.
Mm-hmm. Yeah.
That's a good idea. Thanks.
Thanks.
Mike.
Thank you, Mayor. Mayor, was it your intention on the agenda here to have council officers make a motion with reference to Catherine's memo about the executive order? Because I would be happy to make that motion if it wasn't already planned. So I just didn't know.
Yes, I was just waiting for us to get through this question and answer, and it may be that we're through. And so, yes, if you want to make that motion, I think we are ready for it.
I didn't read. I know that Catherine suggested some language there, so I guess I would say I move to support the manager's extension of the emergency declaration in accordance with the note we got from Catherine.
Second.
Was that a second from someone?
Yeah, I seconded it.
Okay, great. Any discussion? All in favor. Let's see, what's the best way to do this? Can we raise hands? Yes, all in favor signify by raising your hand. So 1, 2, 3, 4, 5, 6, 7. And I can't see Greg. Do you want to just speak verbally?
He raised his hand in the queue.
Okay, he raised his hand. Okay, so that's all 8. Thank you very much for putting that on the table. And thank you. I was struck by Chief Heppel saying the governor's order was barely 2 weeks ago, because it feels forever ago, and
Mhm.
entirely different world. And clearly, even with April 21st as a peak, we still have many weeks to go. So again, I thank everyone for your sort of perseverance and willingness to adapt, and for staff for just keeping this whole big new system moving, as well as the ongoing system. So really thank you very much, both chiefs, for your reports and for your support. And I think with that, we are ready to go on to the next ongoing piece of business, the Northwest Natural franchise. So
Yeah, I mean, that's going to feel good to just do some like regular work, I think.
it is.
I know Ethan's on board, so I'm just going to turn it over to you, Ethan.
Great. Good morning, everyone. Ethan Nelson, the Intergovernmental Relations Manager. I guess it's the afternoon, so good afternoon. And the item for today is an extension for the Northwest Natural Gas franchise agreement. And so in the AIS on March 9th, you had a public hearing related to the item. And I'm going to share with you on the share screen real quick some items to help us walk through. And here it is. Wait. Oh, geez. Show all windows. Okay, hold on. Sorry about this. It's one of those amazing. I had it already. All right, so I'm going to cancel that and going to try again and see if I can pull this stuff up real quick. We had the work session, or excuse me, the piece. There we go. All right, now I'm going to try once more to share screen. And there we go. And is it popping on up now that everybody can see the items for Northwest Natural franchise agreement? Can everyone see this now? Yeah, great. Okay, so this is just helps us to apologize for the delay. Helps with walking through where you've been and where we hope to continue to go. And so your previous council direction, and this was outlined in the work in the AIS back in November of 2018, you had a work session where you started the discussion with staff related to some of the franchise agreement negotiations with Northwest Natural. On January 30th of 2019, you held a work session to discuss the regulation of natural gas, and that was really in regards to some of the work that the Sustainability Commission had provided, and also questions related to regulation of natural gas in association with the Climate Action Plan. In May of 2019, Northwest Natural Gas even gave a presentation, and some of that was mostly focused in on a little bit on the franchise agreement, but mostly on their climate action and their reduction strategies. In late May, you had a franchise agreement extension discussion, and at that point, you moved to direct the city manager to schedule a public hearing on a possible one-year extension. And by July 22nd, for the work session on that item, you moved to adopt an ordinance extending for 6 months. And so we came back and we had a discussion with you recently, and you directed the city manager to put onto the calendar a public hearing related to the franchise agreement extension. And that we held that on March 9th. And as I outlined in the AIS, there were there was representatives from 350 Eugene who came and gave input related to what should be included within the recommendations on what should be included within the natural gas negotiations. And then also a representative from the Eugene Chamber of Commerce that came in support of the extension, the 6-month extension. Throughout that process, that period of time, you've been updated, engaged through some executive sessions, but as well the sounding board, the councilors, Semple, Counselor Zelenka and Counselor Cyrette have been meeting with our internal team on a regular basis to keep you all informed. And which brings us here today for April 8th, where we have just an extension action. And the kind of the motion in front of you is to extend the ordinance for another 6 months here to November 11th, 2020. And with that, I'll bring it back to the main and open up for any questions.
Okay, thank you. I have Alan in the queue. Alan, take it away.
Yeah, I think we've been making really good progress on this. It's extremely complicated. We're the first in the country to even attempt this, so that makes it even more difficult to do since there's no template to follow. We're doing it as we go. I was impressed that we've got so far so fast, but then COVID-19 happened and everything's kind of ground to a halt. So regardless of COVID-19, I think we still needed more time to make this happen and get to a negotiated place with Northwest Natural. And we might not get to where everybody in the community wants us to get, but it'll be a good starting point. As I keep saying over and over again, all the stuff that we're doing is the first step of many. So nothing's is the end of the conversation. And the way that hopefully we'll structure this agreement is that it can be reopened and things can be added to it and changed on not every day, but on a regular basis. So I support the motion for extension.
Any other comments, questions? Betty.
There you go. Betty, your mic might not be working there.
Betty, we can't hear you.
You know sign language or?
She's unmuted. Betty, you might need to turn your sound up on your computer.
Or engage the microphone.
Let's see.
A slight workaround. Counselor Taylor, this is Sarah. I could call you on your cell phone and just play you through my microphone.
That sounds great.
All right, let me do that really quick. All right. Okay, hang on one second. I'm going to put you on speaker and put you by my microphone. Okay.
Okay, my question is just if we, by extending, are we losing the ability to ban future expansion?
Counselor, I'm going to see if Catherine, if you want to weigh in at all on that. Otherwise, I'll take it.
Ethan, you're welcome to answer that question.
Okay. So, Councilor Taylor, if I understand your question correctly, is that by providing a 6-month extension right now, does that prevent council from future action? And in your question, for banning expansion of the natural gas system, is that correct?
Future action in the meantime, we're losing the ability to ban future expansion.
Yeah. So I would say that the franchise agreement, and I hope that this is consistent with the advice and guidance that Catherine has given in the past, and the city attorney, is that the franchise agreement is a contract between two parties, the City of Eugene and Northwest Natural Gas, for the use of the city's right-of-way, for the public right-of-way. Council has the ability to take regulatory action outside of that related to terms or agreements or actions that you deem as a body in the best interest of the public at any time. And so what we've talked about in the past is that while we're in active negotiations, we want to give Northwest Natural Gas clarity as to what council is or isn't going to do during that period of time, with the recognition that future action is always defined by the Future Council Act and purview of that group. Does that help?
I guess so. Thank you.
Nice job, Sarah.
You're welcome.
Yes, thank you for that. Any other questions or concerns? We have a motion on the table. You could take,
I will read it.
please.
Move to adopt an ordinance extending the term of ordinance number 20170, granting to Northwest Natural Gas Company, a corporation, a 20-year non-exclusive right and franchise to lay, maintain, and operate facilities in the public way within the city of Eugene, Oregon, and providing for payment of compensation to the city.
Second.
All right, all in favor?
I have a question.
Oh, I'm sorry.
A
ahead.
20-year non-exclusive right, does this, so this 6 months, we're not committing to 20 years.
30.
That's correct. That was the original franchise that's being extended for the time period. The original
Okay.
one, 20 years.
I just want to check on that. Thanks.
Okay, any other questions need for clarification? All right, all in favor signify by raising your hand in reality or virtually. 1, 2, 3, 4, 5, 6. Who am I missing? 7, 8. Thank you. And that passes. Thank you very, very much. And that is our final order of business, except for I had made a commitment, which I dropped, which was to read a statement for the public about how we will be proceeding with these meetings. So I'm just going to say that now with these last couple of minutes so the public really understands that. So as usual, in work sessions like this one, there is no opportunity for public comment. And so people who want to watch the work session can do so by watching the live stream on our website, the broadcast on Comcast Channel 21, or by calling into one of the phone numbers listed for this meeting on the public webcast and meeting materials webpage on the city's website. Looking ahead to Monday's meeting on the 13th, the meeting will include a public forum as well as 2 public hearings. Information about how to participate in that meeting will be available on the public webcast and meeting materials webpage later this week. And just as a reminder, the URL is www.eugene-or.gov/3360. And of course, as always, all of the other avenues of communication remain open. So counselors are available by email and voicemail. And so we want to make sure that we make it as smooth as possible for the public to continue to weigh in on the issues before us. And thank you all. With that, we are adjourned. Oh, wait, sorry.
I'm
Oh,
adjourned.
you're waving goodbye. Okay, great.
No, Mayor, I just had one question. If
Okay, go
you
for
have
it.
time for it, I apologize. I saw us at
Sorry.
105, so I thought we had time. Sorry.
No, you do have time. I just didn't know.
This is going to sound like a joke because I have often poked fun at this and had some laughs rather than tears. But I've had a number of constituents ask me about it, and some of them are in the medical profession, and I think it's a reasonable question. And it's this: the one place where an awful lot of folks still congregate is grocery stores. And I'm wondering, and I'm not making a motion right now, and I don't know that we need to perhaps do this immediately, but I think it's reasonable for us to consider the idea of suspending our ordinance on reusable bags in the grocery store, at least if not canceling it, because they are a source of contamination that everybody's bringing into the store and dragging across the counters where everybody else's food is. And I think it's a health concern that we need to address.
I just want to comment on that I have noticed. I've been to a couple of different grocery stores, and they are not accepting your personal bags unless you load them yourself. So they're not actually getting dragged across the counter, but
I would think some still are.
Some may still be. So yeah, good point for follow-up, I would say.
Okay.
Mayor,
Yeah.
this is Alan. I noticed that at the Market Choice that I go to, the two that I've been to, they're so incredibly diligent about wiping down everything, wiping down the keypad after I put my credit card in there so people don't have to do cash, wiping down all the surfaces in between each transaction. So hopefully that will also ameliorate any contamination that occurs.
Thank you for that. We'll follow up on that. And I think any other questions, concerns, since we have a couple minutes? Okay, with that, we are adjourned.
Thanks.
Thank you.